Good afternoon, dental internet world. My name is Dr. Vishal Sharma, and I'm once again here alongside my good friend and fellow podcaster, Dr. Mike Parchewski. Mike, it's chaotic times. We're in the midst of an election in Canada. There is a tariff war. The stock market is plummeting. But I found out something interesting from the Federal Trade Commission. There are no tariffs on dental floss. And that's going to bring us into a segue to our guest. Mike, good to see you. Can you introduce our guest, please?
You bet. Good to see you, Vish. And it's really good news about floss. I know there's lots of concerns out there with everybody that flosses all the time religiously, But
one less reason not to floss, tariff exempt.
Yeah, that's it. Welcome, everybody. And thanks again. We're here on another podcast. Today, we have a special guest, Lindsay Janzen. She's a registered dental hygienist who works at the esteemed Vishal Sharma's clinic. And we're appreciative to have her today. And I think today we're going to be talking a lot about her journey in the hygiene world. And maybe she'll bring us up to speed on some of the other tariff information that may affect dental hygiene going forward here.
Hey, Lindsay, how are you?
I'm great, thank you. Thank you guys for inviting me to be on the podcast.
How was the workday?
It was good. I was telling Michelle on the way over, it was a fairly steady, slow day. Surprisingly, I had a lot of patients with a lot of missing teeth. So I was kind of patting myself on the back. I'm thinking, okay, maybe 6 months ago, I was pre-planning my day-to-day just to have an easier day with some dentures and
well, that's
a little
great,
bit slacker.
Because Mike and I, of course, are key opinion leaders with implantology, so that doesn't really bode well for my professional reputation, walking around with edentulous patients all over the place. Yeah, you did have two, which is fairly atypical for our office. So, well, welcome to the podcast. Excited to have you.
Yeah, it's great to have you.
So, Lindsay, you had a journey from a registered dental assistant to a hygienist.
I did. Yep.
And walk us through that journey and how that sort of educational aspect and that work experience has helped you in your current role, not only as a clinical hygienist, but also a burgeoning and aspiring educator.
Yeah. So I practiced as a dental assistant. It was only for a few short-lived years. And it wasn't for me. I think I was looking into hygiene school before I even wrote my board exam for assisting. I had to do a practicum for about a month. And I think just juggling the whole day-to-day, it just wasn't my thing. I like to know who I'm seeing, what my patient, which patients I'm seeing throughout the day, exactly what I'm doing. I like a routine and I like structure. And when I first started assisting, I practiced with a general dentist who we actually worked with at our practice for a few years, and I practiced with as a hygienist. And he was a new grad as well, so we were like the blind leading the blind. So you can only imagine how fun and troublesome that was. So I worked with him for about a year, and then after that, I moved on to work with periodontist within the practice as well. And that's what really pushed me to look into hygiene that much further, because we were doing a lot of implants, a lot of gum grafting, extractions, but I found that that's where I learned more so about the whole periodontal health aspect of oral, of dentistry. So yeah, he was phenomenal to work with as well, but yeah, I liked knowing what my day would look like and what my plan was. So God forbid somebody threw in an extraction or a root canal with general dentistry. I was just flustered. I was one of the world's worst dental assistants. So
yeah, I don't like when they throw in a root canal in my day either, so.
Well, and he was a new grad too, so he was willing to take anything and everything. He just said, yeah, however I can keep my chair busy and full, may as well. So no, it was good. So then I went back to school in Toronto actually for hygiene for a few years and came back to Calgary. And yeah, I worked at an office for a few months just covering a medical leave, and then started up with Vishal. So yeah, it's been good. I found that being an assistant for those few years really taught me about time management. And that's really helped with my hygiene career as well. Just kind of understanding, okay, you have to adapt, you have to understand. Obviously, we're on strict time schedules, and so are our patients as well. But I found that really helped just to kind of navigate, okay, where do I only have a set amount of time. Where do I want to put my emphasis on education? Where can I run over? Even just to utilize your team. How can I implement my team if I am going to run over? And how can we support each other from that aspect? I found assisting also helped just with communicating with my patients as well. So everybody communicates differently, of course. We all interpret and express things in different ways. So I found that that was helpful just to really connect with my patients and communicate with them what we're seeing and what we're doing for them.
Also, just having an understanding, I think, of dentistry. Like one of the things coming out of either dental school or hygiene school, you're limited with your exposure to clinical dentistry.
You are, yeah.
And if you had the chance to work with a general dentist as well as a specialist, like you get exposed to a lot of dentistry. And then I think your explanations as a hygienist coming out are deeper and more profound. Whereas some of the new grads that I've worked with who've only gone to hygiene school, trying to explain malocclusion to them or how an implant osseointegrates, it's speaking Greek. It's complicated for sure. So 7 years now as a hygienist.
Almost 8.
Wow.
Yeah.
Time has flown by.
Oh my gosh.
What is the 8-year anniversary? Is that the tartar anniversary? I'm not quite clear on what's the diamond and silver.
I think it's a tartar. I think it's a tartar.
Calculus. So we'll get you a plaque. No pun intended.
Yeah. Golden scaler.
I think that's the Sonic Care one. Yeah. What a great story. And I do echo when a new hygienist who has an assisting background, I feel like even with what we teach a lot about with technology, they're much more apt to jump into the digital scanning, digital impressions, getting the intraoral camera going more and knowing the value of that. So the technology integration is quite quick. I find sometimes with the newer hygienists, and especially when we have like temps coming in to cover, that tends to be the weak link is integration with technology, using CBCT, using different PMS systems and things like that assistant typically has been exposed to. So I do think there's value there. Beyond your journey, right now in hygiene, there's lots of good things going on. If Arizona passed that the bill about assistants doing supragingival scaling. There's shortages. There was that kind of quiet quitting phase going on. What right now in the hygiene realm, not just for you, but what do you see amongst your peers as what is exciting in hygiene today, and what's driving the hygienists to stay in the industry versus some who are getting maybe disgruntled and walking away from the industry?
Yeah, of course.
Don't say quiet quitting, by the way. It's not going to go over well.
So, I mean, of course, with every hygienist starting out, all you are focused on is just getting your skills down. Like, can I scale? Am I, my time management? Am I educating my patients? Like, there's a million things that are on your mind, and you just want to just appear that you have your life together. And I guess I can't swear on the podcast, but
Michael, bleep that out.
You've got it together in front of the patient. You want to just have a seamless appointment for them. So that's all you're thinking about. And God forbid, suddenly, okay, I have to start implementing an intraoral camera, a spectra camera, maybe scanning, like all that. It's a lot to integrate. So I always encourage our hygienists, especially if they're just starting off at the practice. We have a lot of incredible technology within our office, but I always just tell them, just utilize one tool at a time, even if it's a few weeks of just working on utilizing the intraoral camera for every other patient. And so I always just encourage them, like, just one step at a time. We're going to get it. You've got the team for support and whatnot. But it's kind of cool because I find, and right now too, like hygienists they're coming out of the gate. They're starting hot and heavy. You want to work 5 days a week. You want to work 6 days a week. Like, you want to get hours and get your skills down. But then you start to be exposed to all the other avenues within dentistry. And that's actually what piqued my interest in teaching. Was I just got to the point where I didn't want to eat, sleep, scale, repeat anymore. I wanted to try something different. I felt like I was capable of doing something else. So that's when I had approached Vishal and I just said, look, I got to do something different. Otherwise, I think I'm going to have to cut my hygiene days. But it's kind of cool and it's exciting because we are implementing technology and new tools within our appointments and within our offices. So it switches things up for hygienists. So we're not just using the Cavitron and we're not just probing and taking x-rays all day. Like, we can use the GBT with the the guided biofilm. We're taking more scans, utilizing all those cool devices. So it just kind of switches up your day a little bit. And you're also switching up your appointments too. So it's not just a regular hygiene appointment. Like you can book appointments for desensitizing. We're utilizing lasers within our office now as well. So that was a refresher. When we brought lasers into the office, that was fun. Like just something new to bring into the appointment. And I think patients like that as well, because it's not just the same old hygiene appointment anymore. Like they're seeing that we're utilizing that technology and kind of switching up their appointments as well.
Yeah, I know we introduced, like, what I like to do because I empathize with hygienists. You know, I'm a big proponent of.
You didn't even pronounce empathize properly, so that tells you how genuine that is.
I was trying to think of what that word was. I'm like, maybe I don't know.
I'm reading it from the screen here, but the print's quite small. So I feel for hygienists, how would we say that? And so often I support them very much in the digital exam we've done. We've done a lot of the hygiene-focused exams where what my goal often is to break up their day and give them other responsibilities besides being scaling machines. And we also try to schedule more time. But amongst that, one of those initiatives we did to help give them some breaks was all the whitening was being done in the hygiene chair, right?
Okay, yeah.
So that they would get a break where they'd be able to, set up a patient, do their whitening, do the prep work before the
catch up on
whitening.
notes.
And it's just, and that was funny because because whitening is a bit of a procedure. We got a lot of pushback saying, oh my God, it's complicated, got to do all these things. And then after they're like, actually, this is kind of relaxing. I feel like the dentist here where I can go to my office and check the stock market here. Well, maybe not right now. You don't want to check it.
Bad idea to do that.
Because it is a repetitive profession. And that's why, that's actually what I said before. What intrigued me to go into hygiene was it's a little bit more predictable with what your day looks like. But then it's a double-edged sword because you get to the point where you think, oh my gosh, okay, if I have this discussion about flossing one more time, I can't do this. Like I need something to stimulate me and challenge me and just to have those other discussions. And like I said, I think patients like that too because they're so used to traditional hygiene. So now that we're implementing technology, it's switching things up for them. So they see, okay, hygiene is evolving as dentistry is too, because you guys are utilizing lasers and scanners and 3D printers within your appointments. So it's kind of fun. And I feel grateful that we can utilize that within our hygiene visits as well.
Yeah, dentistry is definitely redundant. There's no doubt. And that's one of the reasons why, in our office or Mike and I have certainly tried to incorporate a lot of technology. It just, number one, makes the patient experience more favorable, things more predictable. But honestly, it keeps things more exciting. And I'm, admittedly, Lindsay chatted with me a little while ago, probably about a year and a half ago, about how you felt like you're in a bit of a rut.
Yeah.
And I wouldn't say that I'm in a rut, but like my clinical days aren't that exciting right now. Like they're just highly predictable. They go really well. I really like my patient base, which is great, but I'm not pushing the envelope on new technologies or new techniques. Everything is just sort of incremental. There's new CERAC materials, but you're not reinventing the wheel. So
have you tried blindfolded?
Yeah, that's sort of how I go through my entire life. But I think one of the things that might be motivating is you said it was sleep, scale, repeat. What was the mantra on that?
Eat, sleep, scale, repeat.
I think Mike had a No Fear t-shirt back in like 1997 that had that exact same logo on that. So yeah, maybe a tattoo on the small of his back saying that as well. Yeah, no, there's no doubt that component can be really interesting. The digitization of dentistry has been invigorating, not only for hygienists, but certainly for dentists and assistants. With that pivot, Lindsay, you've recently started to lecture. And actually last week we were in Charlotte for the KOL Sure Smile Summit, where they brought together about 30 of their top North American KOLs. And, congratulations, you did a great job presenting peer-to-peer from a hygienist perspective. So tell us about sort of that lecturing experience, how you found it, and what really excites you about it.
So that was an incredible opportunity. I've had a few opportunities now to teach hygienists, assistants, dentists as well. And it's great because it's fun when it's postgraduates too, because they're in the thick of it as well. They can relate, they understand. And I just love connecting with other hygienists and other dental peers as well, assistants, admin, whatnot. So it was fun because it was cool to just share what we do within our practice. But more importantly, I want to continue to be a sponge throughout my whole career. So I want to get feedback, and I want to just bounce back and forth ideas as to, okay, what's working for you? What's not working for you? Do you have any ideas? What's your workflow like? So not only sharing what works for us, but also how are you navigating through this tough situation, or time management, or like the number one question that I get is, how are you utilizing the intraoral scanner once you actually implement that into your office? How are you using it in the hygiene appointment? So I like it because you connect with one another and you build that community, but then you also learn from one another as well. And yeah, I would love to dive more into teaching. I had a lot of fun doing it, and it was cool. So the first day we were presenting, and then the second day it was just the presenters and just the dentist there. And they had brought in a public speaking coach, and it was neat to see her work with all the other dentists as well, because it was just such a humbling and good reminder, like, okay, I'm just starting off, I'm navigating through this, I've got hiccups, I'm trying to figure out, like, how do you adapt when, videos don't work within your presentation. So it was really cool to see her, and it was just a good reminder that we're all working on our presenting skills, we're all working on our connections with our patients as well. So it was just good to see that, dentists who have been doing it for 30 years, they're still evolving, they're still working and honing in on their skills. So that was fun. By the second day, I think we were all a lot more comfortable with one another and just feeling a lot more vulnerable and ready to go out.
I left early.
Yeah.
It's interesting though. I know that group well, because when we were initially with Dentsply Sirona trying to promote speaker advocates, they came through a train the trainer program, and I was really opportunistic and thankful that that Dentsply Sirona had me as the speaker advocate, where I was teaching them speaking skills, and it really is a learned skill. Like when you were asked me sort of for some feedback. And I reflected on my first presentation and how much better your speaking skills were than my first presentation, which was terrible.
Thank you.
I felt silly offering feedback. And, even Mike and I have presented together on numerous occasions. You learn something all the time, whether it's dental stuff or public speaking skills. And I really admire the fact that Mike can have a presentation that is truly just a conversation. It's really organic and flows really effectively. And, I've tried to emulate that. It's been challenging because it's quite the skill set. But yeah, you did a great job with that.
Thank you.
And I'm still happy I left early and flew home.
I took notes for you, don't worry.
Yeah, I don't need someone telling me what all my deficiencies with public speaking are. I'm well aware of all my deficiencies. I sit next to Mike all the time.
Oh, yeah, 2 compliments in a row. I don't know.
This thing on? Are we recording?
I'm going to have to play this back a couple of times and put it on repeat.
We can edit out swear words and compliments. So I'm just trying to be empathetic.
Yeah, not euthanatic. So no, I do appreciate that, Vish. Now, one of the things you guys developed, maybe to throw the compliment back at you two, was the concept of the warp, which we've used at our office and I've used in my lectures. And for those of you out there who didn't watch the Warp podcast, watch it. And for anybody else, here's what we're talking about. So we want when a dentist comes into the room, for the hygienist to go through the WARP, which is an acronym for wear, occlusion, restorative, and perio. And as the dentist, we come in and we go backwards through that. So we'll talk about the perio, then the restorative, and then the occlusion and the wear. So we're both respecting each other's main goals, which for the dentist, we're looking, okay, what dentistry can we get going here? And for the hygienist, it's really wanting that respect and the focus on where the periodontal health is. Mm-hmm. So we don't have that usual dentist walks in and goes, everything looks good, Jim, let see on the golf course. And, because I usually get kicked in the shins when I do that. But for you, in that workflow that you guys developed, and again, super appreciative of it because it's really helped my interaction with the hygienist. What do you find is the key with all of that and in the approach and working with the dentist to have success in that transmission of information back and forth?
Yeah. So it's important because it keeps us on track for the hygiene exam, of course, and it helps us hit all of our points so we're not just focused on the perio aspect, if that's my main concern, is the inflammation, but then I'm completely missing the recession or the tooth wear. So it helps all of us hygienists, no matter how long you've been at the practice for, to hit every point. And I mean, sometimes we get busy, sometimes you just have a bad recall or just not a thorough one and you miss a few points. There's times where I don't even tell them the hygiene interval because we're just so focused on ortho or restorative. So it happens, but it's more or less just there to help us like ensure that we're hitting everything. But it's really helpful and it's great because it helps bring the patient into the exam as well. And so we're not just talking about foreign terms or tooth numbers. So it helps us ensure that they're a part of the exam and we're bringing them along with us. So then they're more involved. They're going to ask questions. They can see their scans and their photos, their x-rays up on the TV right in front of them. And that's great because that's going to help educate them and involve them and lead to case acceptance and treatment acceptance. If they can see, oh yeah, that molar has a massive crack on it, that is going to fracture. So then it will push them like, yeah, like you do need a crown on that. So it'll accept that, okay, we're not just making things up and pulling terms from thin air and just diagnosing just to diagnose. Like this is what's happening. You can see this. And yeah, so it's great just because it brings a patient or it brings them along with us. And I find that it just, yeah, even just to communicate with the dentist too, just to support one another. So if I was saying last weekend, I ask a lot of rhetorical questions within our exams. So I'll ask Vishal, like, I'm seeing a little bit more inflammation and patients expressing that they're having some sensitivity on the right-hand side. We're noticing that the recession's getting worse based on the last scans that we took. Are they biting heavier on that side, do you think? Or is it clenching and grinding? What do you think's going on? So obviously I know they're biting heavier on that side. You can see it on the scan. I've showed the patient, the red areas on that scan as well. So they are biting heavier. So when I'm bringing that and I'm bringing it up in front of the patient to Vishal, it's in terms that they understand, they see it, they can get it. And that helps set him up for that conversation, just to hit the nail on the head. Like, yeah, you know what? You are biting heavier on that side. And then we can lead into the ortho discussion to discuss clear aligners.
Yep.
Yeah, that eavesdrop sort of component is how we frame it, where you're discussing the exam through the patient. One of the things that I like to do to avoid the redundancy, Mike, is like when Lindsay asks me a rhetorical question, now I go the opposite direction. When she's like, could it be that the lack of flossing is causing this inflammation? I'll be like, I don't know. You know what? And she expected me to say yes and give an explanation, but like, I want to keep things fresh. I'm like, I don't know. And so sometimes just shrug my shoulders and forget about the warp and I'm out of there.
Mic drop and you're out?
Yes.
Yeah.
Loop drop. Although those ergo loops are expensive, so I'm not dropping those. Yeah, like obviously you touch base on one thing, Lindsay, that we want you to expand on, and that is utilizing some of the scans.
Yeah.
So obviously that is a big push now in dentistry is utilizing digital scans for co-discovery.
Right.
But specifically out of hygiene, how are you employing that technology and how has that been for you and your patient base?
Yeah. So we've got the infrastructure within our office. So in every hygiene appointment or operatory, we've got computer screens right in front of the patient. So during their hygiene appointment, they can just watch TV, Netflix, whatever they want. But as soon as Vishal comes in, I've got their x-rays, their photos, and their scans pulled up. So prior to even bringing them back, I'm pulling up their scans through either DS Core or the iTero website just to make sure that those are pulled up. And I'm also checking the date on them as well. Typically, we try to update those scans every 2 years unless otherwise needed. But yeah, so when I pull up those scans, Vishal comes in, we're going through them together. And just by having those pulled up, sometimes even I'll pull them up before he comes in if I know that they're a patient that likes to get involved and ask those questions. So I'll have them pulled up and then we'll go through them. We'll show them the heavy wear points. If there is any recession, I'll educate them about, if we are watching any recession, we'll encourage them to update those scans day of too. The nice thing about having the Prime Scan 2 as well, like the portable one, is that we can update those scans anywhere within the office. So we're not having to wheel in anything.
That's very fast.
Yeah, very fast. Yeah. So I found that that's actually increased our patient scans as well.
Yep.
And it's pushed us hygienists to scan a little bit more too. And of course, any hygienist can attest to, we're always fighting for time within our appointments. So that's when it really helps build us as a team too, just to utilize one another and say like, hey, you know what, I've got patient in my chair. I do want to update their scans because we've discussed ortho today. They're going to go home and look into their insurance coverage. We're going to follow up with them in about a week, but I want to keep this conversation going. And like, can we just make sure that we update these scans today? So when we follow up with them, if they're ready to proceed, we don't even have to bring them back in to take those scans to proceed with the ortho. So no, even just to show them, like the recession, if it is progressing, say they're not ready to proceed with any treatment, or they're just maybe in denial, just still a little bit opposed to it, I can pull up their scans from 2 years ago versus the ones that we've updated today and show them like, yeah, we are seeing that recession has progressed or that tooth wear has progressed. So they can see like that visual and that evidence, like, okay, we're not just making things up, or, I mean, of course we're updating our probing depths, but this is a little bit more accurate, and patients, and they love to see that technology too.
And I think, we're both very visual in our presentations. And, when we were doing one of our presentations for the Pacific Dental Conference, we dived into the research on it. And it was actually said that a picture is equivalent to 60,000 words, not just 1,000 words. So that was an error. And, I don't know who did that original research, but
Socrates.
Yeah, like honestly. But it just shows you the power of the visual, that our brain processes images so much faster. So we can explain a cavity for 15 minutes. Meanwhile, we're supposed to be doing a root canal in Op 4. Or we could just show them a picture that there's a hole, and it's done, and the power of that visual and having it at your fingertips changes the game when it comes to case acceptance and treatment presentation, and also the speed at which you can get the patients to on board. And really, it all comes back to what has been talked about for so long, is that co-discovery, moniker that is like, yes, co-discovery. But today I really feel that co-discovery is so much easier than it was way back,
Oh, yeah.
And there's less persuasion in dentistry now. Like, I find utilizing this digital technology, it's no longer my job to convince patients to undergo treatment that's in their best interest based on, what I professionally know. Now you have an array of data that has been accumulated over a period of time, and you can clearly see how that crack has migrated or gotten darker, or you can see how that recession has progressed. Now, our role then is to explain what the detrimental end consequences to that are, but you're no longer convincing people that their condition is deteriorating. Yeah. And I've really liked that. It's made me feel less salesy and really just giving options as to what treatment they want to proceed with. And that's been, I think, the biggest positive change from my perspective.
Well, and it's made it a lot easier for us hygienists too, because we always say our role is to, even before technology, is to educate and inform the patient. So I'm going to educate you as to what I'm seeing, what could be the potential causes, and just inform you what could happen if we don't act on treatment, if we do proceed with treatment, so they know all their options. And I found that just having those scans available and patients can see them, it's made it so much more easier to educate them, like you said. And of course, like you can attest to, like, we work downtown, we see a lot of busy people, like lawyers, bankers, accountants. So they want to be in for an hour and out. So if we can utilize that time and really just show them X, Y, and Z, and they don't have to come back for multiple appointments, that is so much easier. And that'll lead to case acceptance.
Better than the TikTok dances that Mike's been doing lately. Higher case acceptance.
Convincing.
With co-discovery. Yeah. Although your choreography is pretty good, I must say.
The co-discovery dance has been a hit.
The co-choreography.
Yeah. So moving forward, when we get into that status scan within the hygiene, you had mentioned you guys are doing that every 2 years, and I think that's kind of what we're doing. And the reason, one of the reasons is we're looking at trying to time it. So on one appointment, they're getting an exam. On one appointment, they're updating X-rays, getting their exam. On another visit, maybe some laser therapy is required. Another visit, maybe they're able to follow up on some outstanding treatment and charting. And another visit, they're getting that status scan. So we're finding that if we're, like you had mentioned earlier, especially with the newer hygienist, if you could just kind of space out the technology, it's, again, fits into the patient schedule, but also fits into your stress level, not trying to do all of these things at once. Right. But when it comes to that status scan and what I like to call sometimes the hygiene exam, where the hygienist drives the treatment because she does spend the most time with the patient, it's sometimes hard for dentists to let go. In your experience, when it comes to kind of letting the hygienist quarterback what's happening with your patient, how have you found dealing with dentists or other hygienists that you've been teaching to accept that kind of mindset?
Yeah, of course. So I always tell hygienists, you've got to collaborate with your team. Like, you've got to communicate with your dentist. it's so worth it just to sit down and just to go over, okay, what are our priorities within our exam? What do you want to see the exam look like? What do you want to see me bringing up? What are we lacking? How can we communicate better just to support one another? Because at the end of the day, we're a team for a reason. We have to utilize one another and find where we can best. Truth be told, within our hygiene appointments, unless I have a little bit of an opening afterwards, or if it's just a hygiene appointment only, no exam, no x-rays, nothing like that, we're utilizing our whole team to update those scans. So everybody on our team is trained to take those scans, even our sterilization assistant, some of our admin team members. So we will not let a patient, if we need to update those scans, we will do everything within our power to update them. So whether it's I have to run into my next appointment for 10 minutes, I'll just shoot a message out to the team, and one of the assistants is going to bring back my next patient. She's going to start with the x-rays. Maybe Vishal is going to jump in and do that exam. So we want to keep everything moving seamlessly without having to bounce that patient around and kind of drop the ball within that. But yeah, I always just emphasize, like, and I'm still working on giving, some feedback to our dentists and our staff members as well too. But Vishal's once said to me, if you don't give feedback to your team members and your coworkers, how are they ever going to learn? If they don't tell me, if I'm not working on something or if something's not getting done with myself, how am I ever going to know unless they give me that feedback? So I think it's just important, keep that communication going and have an open environment, and just emphasizing that everybody needs to be open to feedback if we all want to grow and succeed as a team.
I think a lot of offices still lack some of that intentional methodology on what your systems entail. And, unless you're having a discussion with all team members on what your handoffs will look like, even, dentist to hygienist, but assistants to hygienists or to treatment coordinators, it has to be intentional to have that level of predictability and consistency. And, we've had obviously associates who've been really tenured and experienced. And, right now we've got associates who have, medium experience, or one who's a newer grad, both great. But, they do require, I think, a lot of that sort of feedback and collaboration. So yeah, Lindsay's certainly been great with that. Lindsay, kind of pivoting back over to the hygiene discussion, malocclusion has become such a big part of our respective practices. And of course, you've picked up an expertise in orthodontics and clear aligner therapy, specifically SureSmile. From a hygienist perspective, why is that malocclusion discussion now such an integral part of hygiene treatment and hygiene methodology?
Yeah, of course. So I guess a few different things. So our main focus as hygienists is inflammation. So when we're seeing inflammation, our eyes go big and we go, okay, what is causing this? And why is this happening? Is the patient aware of it? So educating the patient as to how that inflammation can affect their overall and systemic health as well, too. We know that it affects diabetes, cardiovascular disease. So just reducing that inflammation. And I just expressed to them, chronic inflammation isn't good for anybody, anywhere in the body. So if we can reduce it in your mouth just by simply flossing, or of course, addressing the malocclusion, then we can prevent so many further issues down the road.
No tariffs on floss.
I'm going to use that.
Don't steal my jokes. I only have like 6.
Make flossing great again.
Yeah. But even just to educate them on malocclusion, a lot of them have never heard that word before. And a lot of them just think, I don't need, my teeth are straight enough, so I don't need to correct them. And there's no other further issues. I can deal with some of the crowding or some of the overlap. Aesthetically, it doesn't bother me. But it's our job as hygienists just to not even to treatment plan or confirm that they are an ortho candidate, but just to bring up what we're seeing. So when I'm in their mouth, I'm just talking, okay, I'm seeing recession on this side of the mouth. I'm noticing that the tissues are a little bit more inflamed and puffy in that one spot. They're not more so on the left-hand side. So I'm wondering if you might be biting heavier on that right-hand side. And then I'm educating them as to how that recession is progressing through that heavy bite. Of course, I've got my scans pulled up so I can validate, you are biting heavier on that one side. I can see the red areas. Maybe they're wearing down and fracturing teeth a little bit quicker on one side, or just in general posterior. I know that was actually a driving force for my husband as well. He was breaking down a lot of his posterior teeth. Growing up as a kid, his teeth were straight enough, and which is fine. That's all his dentist knew.
Yeah, of course.
Yeah. But that was his driving force to proceed with ortho, was just to correct the bite so he can prevent further issues. And like he says, to prevent me spending more money on my teeth down the road.
Well, which isn't necessarily a bad thing, spending money on your
No.
teeth. It's just, Mike, have you found that patients in general are more sophisticated and nuanced in terms of overall health?
Yeah. So I think that is becoming more and more prevalent. During COVID, there was all kinds of money being invested in longevity and the pods and medical pods and isolation things and all this stuff. And there's such a push now on your microbiome and your genetics and your predispositions, your
Inflammation.
Inflammatory markers. All of these things we're seeing it. P. gingivalis related to Alzheimer's, and so all of these correlations are coming, and a lot of it is based is on our systemic health, right? And the correlations between sleep apnea and health. And I think a lot more of this is being on TikTok and Instagram and social media. So people are seeing it going, oh my God, I got to go to see my hygienist because I might have this P. gingivalis, I might get Alzheimer's. And so I think people are getting better educated and then relating wellness to oral health and seeing that oral health is so correlated to longevity and wellness. We're now seeing that people want to focus on that. But also I think as dental teams, we need to take a bigger focus on that as well.
Yeah, of course.
I found it really interesting how specifically with hygiene, it's the entire oral environment. You're not now just concentrating on bacteria and home care. It's the biomechanical structures and the occlusion, how teeth interact, other host factors that you have. And now that even pivots into overall systemic health. So as a consumer, I find that really exciting. I'm sure as a hygienist, Lindsay, you probably find it much more engaging as well. It'd be interesting to see sort of what the future holds with that. And speaking of, what does the future hold for you? Obviously, it's been a long day, so you're probably going home after this.
No.
But what's next on sort of the teaching horizon? What are your aspirations with that? You seem to be really a rising star in that component. So what are your aspirations, and what can we expect to see more of?
Yeah, well, and even just to touch base on more so on like patients educating themselves. I'm really looking forward to just seeing where technology brings us even in like the next 5 years. Because like you said, patients are coming in, they're more informed nowadays too. They have access to that information. They're more willing to like learn about it and they want to hear about it. And I'm excited to see how that changes. I was thinking about this the other day, how that changes even just their perspective of dentistry and coming from a fear-based background. With the baby boomers, they were all getting dentistry done with, barely any anesthetic. Like you hear that story all the time. So they're still coming in. They're scared. Like they're nervous to be there. So it's kind of cool to see all these generations coming up. And with technology evolving, dentistry is becoming so much faster, painless, easier, and we're involving the patients as well. So I find that when they're understanding and they're becoming more, involved within their oral health and their decisions, that fear is just melting away. Like I barely have any new patients coming in nowadays that are from a younger generation that are nervous or scared of the dentist anymore. So I'm excited to see where that goes, even 5-10 years from now. So it's kind of cool to be a part of that.
Yeah, you're 100% correct. Yeah. Like I had a family member in recently who you met who was petrified.
Yeah.
And had some CEREC restorations at the end. It was just like, that was the best dental experience I've ever had. But that's just a predictable day for us.
Yeah.
But back in 1812, when Canada was last at war with the U.S., it was a very different dental environment back then.
Yeah. So it's really cool to be a part of that.
Tariffs then too, but yeah.
Yeah, no, it's certainly exciting. I can't wait until a robot wheels in for your recalls and I'm just sitting at Starbucks or at home on my kitchen table in my underwear navigating.
And I just click accept.
Yeah.
And that's it.
And I'm wheeling them around with the Atari joystick. Which I know is going to make a comeback.
And based on that comment, we're probably not far away before robots replace us on this podcast, Mike. So
if we're tired of his voice, we can just push him out of the room. No, I hope moving forward, I'm happy. I'm eager to see what the next few years brings for myself. I'm taking a bit of a step back clinically as of recently. I'm only going to be practicing 3 days a week.
That's a sweet spot,
and
right? That's a sweet spot.
Well, and I feel very fortunate to be able to do so. But like we were discussing earlier, I just got to the point where I felt so itchy to try something new and push myself. And dentistry is such a cool industry to be in because there are avenues to do that. You don't have to go back to school for business if you don't want to, or sales. Like, you can get into any aspect. So I love the teaching component. Again, I just love connecting with other dental professionals and just learning from one another. So I'm really eager to dive more into that and to really hone in on my speaking skills and my presentation skills and just to see what else is out there. So I don't know if I'll ever drop my clinical days. I love just BSing with my patients and keeping those connections and seeing them a couple times a year. So and it's good to stay relevant too. You got to keep one foot on the ground just to stay relevant when you are practicing and when you are teaching as well, just to share your stories and what you've experienced. So
yeah, I think that creates authenticity. You really need to be practicing what you preach.
yes,
Mike and I would certainly
exactly,
test that.
exactly.
So,
Yeah.
Lindsay, thank you for joining us in our podcast. You've been a great guest, and we're really excited to see where your career goes and how that itch continues, which I think itchiness is a side effect of PG actually. And Mike, I'll pass it over to you to wrap up the episode.
Well, thanks, Lindsay, again. And based on this podcast, your speaking ability is way up there. You're doing great.
Thank you, guys.
So I look forward to seeing what you've got going on in the future and more stuff that you're doing on how a hygienist can be involved with aligner therapy. I think that's exciting. Always pushing the envelope is what I appreciate. Thanks, everybody. Thanks, Vish, as always. Please like and subscribe at Digital Workflow Dentistry for more information on our Instagram handle. Take care, everybody.